Suppose a significant proportion of cardiac death, or what we presume was sudden cardiac death, was not actually directly related to the heart. Now, this is a really deep scientific discussion, so you have to bear with me. And it was related to an interview that I had with Dr. Dov Gebian, and he was speaking about sudden infant death syndrome and his take on diaphragmatic splinting. He's done some papers on it, and in the link in the description is the interview. But very quickly, as I discussed with him about his insights and what he saw and what he thought was relevant, I saw something there that I think is so significant that I am going to be exploring it at the moment with you. So, as I said, if you are interested in the full interview, the link is in the description. We were talking primarily about sudden infant death, but as we went through the discussion, there are so many other things that came out, and this is the article I've done with it, that this is worth your time to take a good look at. It's free for you to see. And I'm going to now share with you some insights into what has come out of it in my subsequent analysis. Okay. So I then go away from the discussion and I think about it. So the essence of what he was saying was that he believes that sudden infant death syndrome, where the parents find them not breathing the next day they've passed away, could actually not necessarily be the heart, but the diaphragm. And in order to understand it, you have to understand a little bit about how you breathe. And this is what we had shared yesterday, is that normally most of your breathing is done by the diaphragm. As it contracts, it pulls down and it pulls air into the lungs. Now, you can also breathe in the respiratory muscles, but usually people only do that when they're really struggling, like an asthmatic, because in those cases, their lungs are full of air. It's already splinted, so the diaphragm is maximally expanded. They can't get air out easily, and so they have to use their chest wall muscles to continue to breathe. And what he was essentially saying is that he thinks that in these little babies, their diaphragm could have gone into spasm, and so therefore they stopped breathing because they didn't know how to use their respiratory muscles to compensate. And that's the essence of what it was about. And we were talking about the science around it. But my thinking was an extrapolation. I suddenly realized that, hold on, if that could happen in an infant, could this happen in an adult? And so I thought, this happens in sleep with infants. Would this also happen, or could it happen in adults? So this is where the hypothesis is. So understand carefully, I am exploring some thoughts with you. This is not factual. This is just me looking at the research and extrapolating some thinking. So follow this here. And this is important in terms of trying to understand what really is or could potentially be going on. So let's look at it in a little bit of detail. When they looked at this Australian study, so this is a prospective study of sudden cardiac death among children and young adults. The first thing you have to notice is we call it sudden cardiac death. And that's because we assume it's the heart. That's the first thing that you have to acknowledge. Our assumption is that it is the heart. We haven't really considered anything else. And this is why this interview was so fascinating. He genuinely has seen something here that I think is very unusual, very unique. So when I look at the data from Australia, and this is what they found, when you look at all sudden cardiac death, unexplained death, they broke it down according to all sudden cardiac death and unexplained sudden cardiac death. So in some, we have a good idea as to what may be the cause. And when you look at the age groups here, highest was age 31 to 35, and then you see here 1 to 5 as well, similar to sudden infant death syndrome, SIDS. Here is the bit that is really interesting to note, and I'll try and make this bigger so that you can look at it. Causes of sudden cardiac death. Unexplained is the biggest one. Now, most of these people, because they're young, will have an autopsy. Some of them have coronary artery disease. So you would presume this is cardiac. Dilated cardiomyopathy, perfect, cardiac. Myocarditis, cardiac. Cardiomyopathy, arrhythmogenic cardiomyopathy, cardiac. Hypertrophic cardiomyopathy, cardiac. Aortic dissection, that's a bleed, other. The vast majority that we know are cardiac. But the unexplained, we have assumed is the heart. That's a very important point. When you look carefully at it, and this is now the next step, look at the proportion who have had this occur while they were sleeping. Some have had it at rest, some with light activity, some with exercise, post-exercise. Those make sense for the cardiac ones because as they stress the heart, they could then go into an arrhythmia. But why would you go into an arrhythmia during sleep? So what I had thought initially is that, and I put it to him at the time, I said, well, what about the fact that we know that there is a significant change in cortisol at about 4 a.m. And when you see patients have cardiac arrhythmias or they go into left ventricular failure, it tends to happen at around between 4 and 6 in the morning, and that could be linked to it. But these people usually have background heart disease, not a normal, simple person. So it doesn't make sense for someone who has no known cardiac disease, no cardiac disease on autopsy, to just suddenly have a cardiac arrest. And it's usually going to be an arrhythmia. So they'd go into ventricular fibrillation, they can't pump, and so they pass away. And that has been our assumption. Now, this is where we get into a little bit more of the science. So as I said, I'm sharing with you the papers so that you can see that this is an extrapolation of the thinking, but I am showing you how I'm thinking and why I'm thinking about what I'm looking at. When we look here, this is now sudden arrhythmic death syndrome in the young. Looking, and this is from Sweden, so this is a Swedish study, and this is from 2025, so this is pretty recent. And so they were looking at all of the deaths, and we call it sudden arrhythmic death syndrome, meaning that we are saying it's the heart, and it's the most common post-mortem diagnosis in the young suffering from sudden cardiac death. So the point is that we have assumed it is the heart. Suppose it isn't. So let's look at this in a little bit more detail. As I said, it's fascinating. Now, this is the table that caught my attention in the paper. When I looked at this table, I thought to myself, the total number of cases, symptoms within 24 hours prior to them dying, okay? When you look at the symptoms, palpitations here, number of cases, 12 of them had palpitations. Only 2 had symptoms prior to their sudden cardiac death. Now, if you are having palpitations, that does sound that maybe there is an underlying heart disease. So that makes sense. Even chest pain makes sense, but not necessarily abdominal pain. Now, sometimes chest pain can feel like abdominal pain. So this one is a question mark in my mind. Shortness of breath. Okay, that could be cardiac. Nausea and vomiting is possible. You can get that with a cardiac symptom as well. Syncope, fainting, yes, that could make sense. Seizure, not really. Headache, no, that doesn't fit. Infection, Most infections are going to be respiratory unless they have a myocarditis. But usually you get pretty sick with a myocarditis, especially if you're young, before you would have an arrhythmia. So these people were at home, fatigue, malaise. So there are a number of symptoms here that don't fit the cardiac picture. And so this is what I'm saying, is that this is starting to look as though maybe we have missed something here. I can understand cardiac arrhythmias if there's underlying heart disease occurring during sleep. I can understand it occurring during exercise. But for someone where no clear cardiac pathology was found and died in their sleep when they are young, that doesn't quite fit, especially, and look at again at the image. Look at this with infection. They had infection symptoms here: fever, cough, and cold. Okay? This is within 24 hours of the sudden cardiac death. This cohort here had symptoms. This is orange, means symptoms within 24 hours. All of them had infection symptoms within 24 hours of sudden cardiac death. Unless it's myocarditis, this doesn't make sense. So now let's go back to the theory. The theory here is it possible that, similar to babies, theoretically, the diaphragm, while someone is asleep, goes into spasm? Say, for instance, this is a point that Dr. Gibin was making, is that if there is inflammation in the diaphragm, it is possible that it could react differently and then potentially go into spasm. And if it went into spasm, what would it feel like? Now, I thought about this a little, and the best I can describe to you is this. What you do is take a deep breath in, a maximal breath, like, now try and breathe without using your abdomen. That's the kind of thing that could potentially happen, is where the diaphragm maximally expanded and in spasm with someone asleep, they would wake up with the feeling of not being able to get air. And what he said is that what the person had done is that they exhaled, which was counterintuitive, but that seemed to work. And the principle is that if someone had this occur whilst they were sleeping and had the associated respiratory failure that would occur, they could then even go into a cardiac arrhythmia on top of it. But it raises a question that I had never considered before, that sudden death, I'm not saying cardiac death, sudden death in sleep, that's the critical thing. Sudden death in sleep could potentially be a diaphragmatic issue. And again, as I pointed out from the Australia data, just look at the data. It is unbelievable. The vast majority of these episodes occurred during sleep. We've recognized that a proportion of them had heart problems. This cohort here makes sense. This is an arrhythmia. But the unexplained, with no heart disease and occurring in sleep, this could be something else. And what we have to do is allow ourselves to contemplate the potential. And so this is why I'm sharing it with you, because it genuinely, it stuck with me, and I thought this is important. I suspect that this is a really important discussion, and I'm going to be exploring it further. If you want to listen to the interview here, look in the description. We spoke about a lot more than just sudden infant death syndrome, but it opened a door in thinking that I believe could be quite relevant to what we're seeing going forward. If we understand it, is there a way it could be mitigated? Is there a way people could be identified? That is the big question. And this is why at the end of the day, whatever we may think, unexplained shouldn't remain unexplained. Unexplained should be unexplained at the moment, but we will continue to look until we find the reason that is relevant. Thank you for listening, and look out for more insights in the near future.